Welcome to our broadcast. I'm your host, Sarah Vaezi, Chief of Digital and Growth Strategy for Providence. As a reminder, the information provided during this event is for informational purposes only. For any medical questions, please reach out to your primary care provider or healthcare professional. Now let's begin. Joining me today for this live event is Aaron Martin, EVP and Chief Digital Officer at Providence and Managing General Partner for Providence Ventures. I'm really excited to talk with Aaron. We always have great conversations. And today we're going to be talking about our 2022 digital predictions. Or in other words, kind of the things that we're focused on for 2022. We've got 2021 was a really interesting year. 2020 was a very challenging year. Both have been very challenging years. And so we're looking forward to 2022 and a lot of exciting things happening in digital and healthcare IT. And we're going to share some of those with you today. So welcome, Aaron. Thanks for joining today. Can you please just start by giving a brief overview of what you do at Providence in terms of like your oversight of digital marketing and ventures and how the pieces fit together, just to give folks some context?
Yeah, sure thing. Can you hear me okay, Sarah, through the stream?
Oh, sounds great.
I think, a couple of things. I've been at Providence now for 8 years this January, so I think I'm near to or certain to kind of be probably cross my 8-year anniversary here, and my role has kind of three components to it. One is my team runs marketing, so any brand in and outbound marketing, digital, which has an operational component to it. So anything that the consumer or the patient sees, from a digital perspective, our websites or apps, et cetera. We also have an incubator in there as well, so that creates new companies and new technologies where we see gaps in the market. And then third part is the venture team, so Providence Ventures. And so we've got a $300 million fund with I can't believe it, but 27 portfolio companies. It's really kind of grown over time. So that's a little bit about my background and what I'm up to.
Awesome, thanks. So with that kind of as a backdrop, you have a very unique vantage point within the organization, both internal and externally facing. Can you tell us a little bit more about, we published our 2022 digital predictions earlier this week. From your perspective, how did you come up with that list? Like where did these ideas come from? Let's just start there.
Yeah, I think, as is with everything with our team, and Sarah, obviously you're kind of my co-author on this, it's about kind of listening to our health system, paying attention to what's going on in the industry. So we've got, obviously we talk to our operational and clinical colleagues on a constant basis. We also have many conversations with other health systems, and then also innovators in the market, both big tech companies, startups, et cetera. And what you get is a real kind of sense as to what's going on in the market, and and just kind of synthesizing what is going to be kind of a priority for 2022. What are people thinking about? What are they worried about? What are they predicting? And it's interesting, we were a few weeks late and kind of getting this out the door because things are changing just so rapidly with Omicron and those types of things. I think that's how we've kind of gotten the list together.
Yeah, definitely. I mean, it's been a real both looking at the market. You have great pattern recognition, seeing so many companies out there, mm-hmm. looking at talking with experts from government to other health systems, payers, big tech, as you noted. So it really is the synthesis of all of that and just looking at those trends, and then what's going on internally in our own system and what are the big problems that we're trying to solve.
Yeah, and the digital predictions are just a reflection of how does technology kind of interface or intersect with the big patterns that are going on out there and the big trends and what's impacting our health system and other health systems.
So with that, if you had to pick the two, we wrote a lot. If you had to pick the two that you think are going to be most impactful this year, in terms of impact on this on our health system from the perspective of a large integrated delivery network, what do which ones do you think are going to be the most impactful for 2022, and how is that impacting your priorities from a digital perspective and the things that we're working on?
Yeah, I'll actually pick three, that I think, that are, one is super acute, but is not going to go away, which is the workforce crisis. And, how that's the first one. So how that kind of, intersects with it is, and how digital can be helpful is obviously, there's some really interesting businesses out there that are helping kind of, with a better, more efficient, for instance, sourcing of talent. But our health system, like every other health system, is really is struggling by getting enough caregivers to serve our patients on staff. That's a result of the acceleration of a workforce crisis that's been coming for several decades. COVID moved it up 4 to 5 years, right? The second thing is obviously. Omicron in particular has made it very acute because now we've got caregivers who have gotten infected and are out for kind of 5 to 10 days, can't serve patients, can't take care of patients, and so in December and January it's been highly acute, I would say. And so there's several different things that in the short term and in the long term could help from a digital standpoint. From a short-term standpoint, there's some really interesting, sourcing technologies out in the marketplace. There are labor marketplaces being kind of built and deployed, serving health systems that make it easier and more flexible for, temporary kind of agency workers to kind of work with us. And then there's kind of medium-term solutions for it as well. So a big one is digital self-service. A big kind of promise of digital and the ability to kind of empower the patient to do, frankly, to take some of the work off of our schedulers and our caregivers to do it themselves is going to be a huge long-term benefit to our health system if we can really truly get it to scale. We've estimated it costs us anywhere from $4 to $8 per scheduled event just to schedule a patient within a physician's office, for instance. So if they can do that themselves online, which they prefer to do because we're always open 24/7, et cetera, that's a benefit for both us as a health system and to those patients. Other areas are digital clinical support. So the ability to kind of better leverage our caregiver time and make every kind of encounter more efficient with a much more informed encounter. A much more automated encounter and a lot less kind of friction in terms of getting to that encounter is super important. And then finally, digital first disruptive models of care. So, I think in that area, where patients can experience most of the care either through asynchronous communications such as text or chat, as well as obviously through telehealth. Again, it's going to improve productivity and efficiency. And then finally, care for caregivers. So a lot of this is driven, a lot of the workforce that's being kind of leaving healthcare is driven by burnout. And so if there are ways that we can, help kind of combat burnout through, digital solutions for anxiety and depression, et cetera, that will scale. I think that's a super big part of the solution, that where digital can contribute to the solution.
Yeah, and I think you highlighted something really interesting in maybe it was your third or fourth bucket, but around just this notion of like, if you can actively and more accurately match supply to demand, for instance, around different modalities of care, you get folks to the right care at the right time. It wastes less time, both on the patient side as well as on the provider side. And while it may seem indirect, it actually has huge implications for the workforce crisis, right? The more we can minimize getting a patient to a provider that maybe it wasn't the right provider, that can be huge, right? Or enabling modalities that really are much more efficient uses of provider time, like asynchronous care, to your point. So that's another area I think that's going to be really, really powerful.
Yeah, and then in the longer term, think 2, maybe 3 years out, you're going to start to see AI kind of assisting with the care. Initially, just to kind of help kind of automate the workflows, navigation, those types of things. But eventually, doing kind of kind of a differential diagnoses that the care provider can, that will kind of speed up the diagnostic process. And then my hope is, maybe over a 5 to 10 year period for very, very simple, high volume, low risk scenarios where, there's actually an automated kind of both diagnose and treat solution where AI does the entire thing, front to back. If you look at, and what a lot of our caregivers deal with is it's the boring, repetitive tasks like online scheduling. But even in a clinical scenario, there's a lot of very algorithmically generated or driven diagnoses for very kind of low risk scenarios that could be just treated by a machine eventually. We're 5 to 10 years away from that. But if we don't get to something like that, we're going to constantly be underutilizing the valuable time of our clinicians who should be in the business of using judgment, kind of human interaction and providing care. It would really kind of help them kind of practice at the true top of their license if those types of technologies would gain traction over a 5 to 10 year period. So there's kind of a short term, medium term, and long term. The second area I would kind of call out is personalization and engagement. This is something that my team has been working on for a couple of years now, but it's definitely hit the mainstream, at least on the provider side of things, and it's very, very important.
Can you tell us a little bit more about what you mean when you say consumer, personalization and engagement? I think it can mean a lot of different things to different people, and especially as it's become a little bit more mainstream, it can mean different things. It's kind of like, the new digital front door, which, right. That was a few years ago, everyone was using that word, and now we've talked or folks have been really talking about engagement and personalization. So what do you mean by that when you talk about that?
Yeah, I think there's 3 kind of components to it that really matter. The first is identity. And so that is a very basic concept. And what it means is having a single kind of identity for a patient that you can build a 360 view of them, not only in terms of their clinical status, but other, how they're engaging with content, their behavior on the website, et cetera, so that you can kind of then drive personalization, which means tailoring the care experience, the customer experience to that patient based on what you know about them. And then the final piece is that then generates a result, which is engagement. So sometimes those 3 concepts get kind of munged together. It starts with identity, because if you can't identify who this person is, and this is a big problem for health systems because they have in most scenarios, they have many different kind of logins that a consumer would come into. The first step for us was to deploy last year SSO, which is single sign-on, which eliminates the friction of having to have 5 different identities, let's say, or sets of credentials to kind of deal with us. If you're dealing with say a pregnancy app, and you're dealing with MyChart, you're dealing with our app. Before we deployed SSO, hypothetically, you could have 3 different credentials for that. It's very confusing for the consumer, and it's really hard for us as well. And then the second piece is, then once you've got, all right, that's that one single person, and then if they give you, access to their, allow you to and opt into this, then you can start building a personalized experience around that, because every single time they've logged in, you've got their history, et cetera, and it eliminates a lot of the things that patients complain about how the health system works, which is every single time offline you go to, let's say, a new clinic, it's like they've never seen you before. They don't know who you are. And we have a whole kind of vision around know me, care for me, ease my way, and we need to really kind of nail down the know me part of that, which is what identity and personalization is around. And if you get those two things dealt with, then you get high levels of engagement. And engagement has two impacts. In a fee-for-service environment, you've got a close relationship with your patient, and it will build better and better engagement, and it'll be more likely that they'll go to you for care. In a risk environment, it's even more powerful, because under risk you can do things like, for instance, at scale personalize treatment, care gap closures, et cetera, because you've got a good bead on who this person is and what their needs are.
Yeah, and if I were to summarize my key takeaway from that, is the first step is to reduce the fragmentation around identity. That begins to solve the problem around fragmentation around the experience more generally. But that's step one, and you have to do that before you can kind of truly get seamlessness across at least your digital experience, and then hopefully it extends into the offline experience as well.
That's exactly right.
If you so we talked about two that you think are going to have significant impact. Which one worries you the most? Which one of these predictions worries you the most? I can say from my perspective, I think payer-provider convergence is going to have a tremendous impact on our economics and on our relationships with consumers and patients. What do you think? What worries you the most, and why?
That was going to be my third choice. So if you're going to work on three things that it's not even really it's not even really a choice, So if you've got the workforce crisis, you've got engagement, and then you've got payer provider convergence. If you're not building a really kind of cohesive experience between a payer partner, we're lucky in our case in which we've got several close payer partners, but we also own our own. We also have our own captive, insurance plan as well in Oregon. If you're not building kind of a coherent, integrated experience, you're going to start to face some national payer providers that and they're going to beat you in the market. And so, for instance, you look at the amount of money that Optum United is spending on not only their insurance experience, but also they're buying providers, and guaranteed. One of the things that they're working on is how to get rid of the traditional kind of poor handoffs between the payer and the provider that the patient experiences every single day, or a Humana or a CVS Aetna, all making investments in kind of much more verticalized experience, where the consumer feels like these aren't two different entities that don't seem to know what's going on. And so I think that's a huge thing. And so the other piece of it as well is that as we all experience, providers experienced during COVID, those that were under a lot of risk and had kind of knowable revenue streams, instead of kind of fee-for-service revenue streams, were much more at risk, had much better, financial results during COVID than those that didn't. And we saw that within our own health system. Oregon and Southern California, under a lot of risk, fared a lot better during the depths of COVID than, say, for instance, some of our other regions that are heavily fee-for-service.
Yep. Yeah, definitely. That makes a lot of sense. One of the things that you noted at the beginning, you've been with Providence for 8 years. We've been on a digital journey for quite some time. Is there anything on this list that is like completely new that you weren't thinking about at all last year and now has suddenly cropped up as something that is absolutely mission critical? Or are these things that, you've built a foundation for and have been working toward for some time?
Yeah, I think, it's one of these things where here's one of the things that I always think about is the time between now and when we really start to feel disruption from these other payer providers and from kind of other digital entities, et cetera, new entrants into the market. That time is evaporating. Somebody asked me just the other day, who's new to the health system, well, they were surprised when I didn't say, well, we've got kind of 5 to 10 years to figure this out, because that's the general answer you generally have within healthcare. I think we've got, possibly next year, this year and early into next year, we're really going to start to feel it from, some of these disruptive forces. I think the biggest ones are going to be the payviders, entering into some of these markets, disrupting kind of the existing, care patterns and the provider networks. I think the other thing you're going to see fast following that, whether it be venture-backed companies, big tech, et cetera, you're going to see these digital-first offerings start to mature and get to scale, and really have, pretty significant impacts on, business lines that, health systems care about.
Yep. I'll end with one final question, which is like you alluded to it. What are the reactions that you've been getting about these predictions from health system colleagues, whether they be within Providence or external to the system, and from the innovation community, whether they're technology, venture-backed startup? What are the different reactions that you've been getting, and any reactions that have particularly surprised you?
None that have surprised me. I think, we've gotten past people understanding what it is and that it's coming. Now it's more to kind of, do we have the institutional will as incumbents to do the hard things to do something about it? These aren't going to be, what happened very quickly during COVID was, a lot of, across the industry, a lot of digital was deployed very quickly, and it was kind of, in a lot of cases, lacquered across existing business models, right? And that's not going to be good enough, because these disruptive new business models tend to be digital first. They tend to not have clinicians being pulled in 5 different ways to do, 5 different business models. They tend to be very focused. They tend to be built for purpose. And so I think what it's going to be interesting to see is do health systems have the institutional will to stand up basically internal competition for their existing business lines that are digital first? We've done it in a number of different cases and been successful with it, but we need to do it, faster and more extensively across primary care, start to look at specialty and in our surgical areas, et cetera. It's gone from being something that's been a nice demonstration to something that we've really got to start to get to scale before somebody else does it for us.
Yep, the urgency message is very clear, and I think I've heard if you're not worried, then there's something wrong. Right? So,
you're not paying attention.
You're not paying attention. Exactly. Well, Aaron, thanks so much for joining today. As always, even though we co-authored the work, I still learn something every time we talk. So thank you for joining, and thank you all for joining and listening and sending in your questions. To learn more about our initiatives, programs, services, ways to give, or if you're looking for medical care, please visit providence.org. You can also learn more about the Digital Innovation Group at providence-dig.org. And make sure to follow us on social media at Providence Health System for LinkedIn, Facebook, and Instagram, and under Providence on Twitter. Thank you again for joining.